Lyme disease, for some people, just seems to never end. And even after the bite, maybe you got bit and the bite goes away, maybe the symptoms sort of go away, but you still don't feel 100%, and you know something's still there, and maybe the doctors are looking at you like maybe it's in your head. Well, there's some rationale for you that I think you're going to enjoy from my perspective. And I've been in practice now for 27 years. And what we do here is radically different than everybody else, but it's all based on getting your body to heal itself. So I think you're going to really enjoy this conversation about Lyme disease, and you're going to understand that there is hope for this condition.
Alrighty, today I'm here with Dr. Chris Cormier. We are going to be talking about Lyme disease today. Dr. Cormier, first question for you is, when people come to you with a history of Lyme disease, what do they almost always say has not made sense with their recovery?
They're oftentimes so confused because they've tried so many different things. They don't know what's going to work, and they really just don't know where to go because there's so many, I guess, over-promising and under-delivering types of clinics that have maybe worked with them and not gotten the results that they need to get.
At that stage of Lyme disease, what are they most afraid of hearing or not hearing from another doctor?
That there's no cure, that there's no way to get out of it, and the contrary is possible. But with this particular condition, you want to think of your body having 30 trillion cells, and the more cell groups in your body that get affected by different stresses and start to lose their health, well, they get vulnerable, and they can be infected by a bacteria like Lyme. They can get all kinds of other viruses and fungus, and various different things can affect those cells, toxins. The more those cells get unhealthy, the more opportunistic like Lyme start to really take control.
And people with Lyme disease, what do symptoms often instead of resolved?
They have all kinds of different symptoms. Sometimes they just hurt all over. Just the pain is so that they just really can't take it. It's like they don't know what else to do. And then they can also have ear aching is another symptom we see with it. But you almost want to think of it as like Lyme bacteria itself is a bacteria, but it looks like a parasite, and so it literally will bore its way into and tissues and stuff in your body. So it's extremely painful for people. It just zaps their energy. They literally just don't have any energy.
Why do their symptoms usually flare up during stress, emotional shock, exhaustion, years after treatment?
Exactly kind of what I mentioned to you before. You have 30 trillion cells, and every single one of those cells, you want it to be healthy. But unfortunately, none of us are born with a perfect set. We all have genetic defects. And from the moment you start living, you have 3 different types of stress. You have physical stress, emotional stress, and environmental stress. And any one of those stresses you ever encounter throughout your whole entire life can knock the health off in some of the cells. And so it could be different cells. It could be cells in an organ, a bone, a skin, muscle, wherever the cells are, they lose their health. And if you don't recover the health in those cells, sometimes they never recover.
Many patients are told the infection is gone. Why doesn't the body behave as if it really is all over?
So there's so many cofactors with Lyme. It's not just the Lyme bacteria. A lot of times because the cells are so weak, they've been attacked by bacteria, but they also can get viralized. Old viruses can reactivate. And sometimes doesn't show up. People can't find those things on testing. But then the cells, remember, the weaker they become, the more pathogens or microbes can still keep attacking. So one time it might be a little more mold attacking, another time it might be more bacteria, because you don't just have the Lyme bacteria, it could be staph or strep or other bacteria, and then you have these viruses that are around as well. So it's a lot. And then you also have parasites that are in there as well.
A lot, for sure. What warning signs of Lyme-related nervous system stress are most commonly dismissed or normalized?
So people can have just areas that are painful that are on and off, and people think, oh yeah, it's gone. They take, counter meds, whatever, and they mask those symptoms, the pain, the aching, whatever's going on in their body, and don't really pay attention to those until things get really bad. But they keep masking. A lot of times we see that where they just take, a lot of times these farmers, big pharma has all these products that are aimed at just getting rid of your symptom but not fixing the root of the problem, and that's where people go wrong.
You see a lot of patients on a day-to-day basis. When someone with Lyme walks into your clinic, what do you notice immediately that the blood work really never shows?
Like one is almost every case we see has activated viruses. And a lot of times that's not showing up on blood work. It could just be a pocket of a virus that activated. Remember, viruses are in your body. Whatever virus has ever gotten into any one of your cells is going to stay in that cell for the rest of your life. So it waits for the cell to get weak and then it reactivates sometimes. So that's what we see is all the different things that can reactivate or be attracted based on those weaknesses when you do get Lyme.
Why does the nervous system stay in survival mode after Lyme disease is considered resolved?
Okay, so we talked about this before, where the nervous system has two sides. You have a sympathetic side and you have this parasympathetic side. This sympathetic side is a surviving, worried, fearful side, and then the other side is the calming, healing, relaxing, digestive side. And so we want everybody to be in the middle, where you need to go to one side of the nervous system and heal, and you come back to the middle. If you need to go worry and move out of the way from a baseball, you can do that with the sympathetic side. Most people, outside of people with Lyme, most people in general are over-sympathetic. But you can imagine when you let yourself get a condition like when it attacks you and gets you, your healing side is not working. So that self-healing, the ability to heal itself, is on that parasympathetic side, and it's just not healing. So even if you do maybe take some drugs and try to kill the bacteria, you have to strengthen that nervous system back, because otherwise that parasympathetic, if it doesn't get strong again, it'll be vulnerable again to infections, more problems.
Why does the body react before logic, reassurance, or a medical explanation can catch up?
So our bodies are amazingly God-made, and they're made to heal themselves. And Big Pharma's done a wonderful job of not making you believe in that, but your body is designed to heal itself. You think about it, if you get a cut, that cut should heal, and you should not even know where a scar is. You can't even see where it was. That would be where a cut gets into healthy cells. But if you have a cut into unhealthy cells, it may take longer to heal, and there may be a scar. And then the third example would be like where you get a cut and it's not healing. That would be like dying cells, right? So we have cells. Nobody has a perfect set of healthy cells, so everybody has these unhealthy cells in their body, and the more of those you get, the more vulnerable you become.
What actually changes when a Lyme-affected nervous system finally feels like it's safe?
So feels so much better. It's like their energy comes back, because it's been these like Lyme and all the co-infections, they rob your ability to function. And you just, to where you were just maybe super successful doing all the stuff you want to do, and then these things come in and they just rob all your energy. You have none. So the first thing we start to see is people start to get their energy back. They start to feel better. The pain goes down. They're just like laying down in a corner, not being able to move, or starting the day okay, and then by 12 o'clock, they can move. Start to see all those symptoms go away.
Awesome. Many patients are later told that they now have an autoimmune disease. Why does that happen so often?
Well, autoimmune people to throw that term around nowadays. It's popular. When I first started practicing decades ago, I think there was only a couple of autoimmune conditions. Now there's close to 200. They just keep naming names, but remember, it goes back to cells, right? So if you have healthy cells, like everybody does, you have unhealthy cells. The more unhealthy and dying cells in your body that you have, your body literally will protect itself. It'll start trying to kill those unhealthy cells. So it's the reverse of what people think. Autoimmune is not you're attacking healthy cells, it's attacking the bad cells. So the symptoms in autoimmune a lot of times are similar because Lyme is just so debilitating, like some of the autoimmune conditions are as well. But you can also have both at the same time,
Wow.
which we see.
In your experience, how often is autoimmune a description of nervous system deregulation rather than a root cause?
That's okay. Yeah. So nervous system deregulation, really, as we've talked about, so your brain is here, right? It's your power company, and it powers 30 trillion cells, right? So it's literally wired to all these different cells in your body. And what happens to people is the more disconnects your brain has to various cell groups, the weaker those cells become, and then they become vulnerable. And so we always call it your light energy, and that's your fiber optics. Literally, that's what it is, it's fiber optics. So we have the ability to get fiber optic power, check it, and get it back to the cells, which is extraordinary, yes.
What happens when Lyme disease is treated as an immune attack instead of a system stuck in defense? In my either one of those routes is not necessarily right. I think it should be on our side where we're doing oxygen, we're doing water, we're doing light, we're trying to get all these cells connected and healthy again. We do oxygen because remember it's the number one ingredient in your cells, but unfortunately nobody has enough because we don't breathe enough and we don't know what we're breathing anymore. So we got to get oxygen back to cells, we got to get water, we got to get the cells properly hydrated. And then we also have to get each cell connected to the brain properly to get all this back. And then that allows the body to start properly. We also use frequency, which is another thing that's really, really important. Cells is keeping them tuned up. Why does fighting the immune system often make these patients worse instead of better?
Because it's not addressing the root cause. The immune system in your body is designed to try to heal itself, but when it gets overwhelmed, it just can't do its job. So you have to go back to basics with this type of condition. You got to really get into the basic ingredients, just connecting the brain back to the cells, making the brain aware that there are problematic things in the body, like Lyme bacteria. If your brain isn't aware of it, then it doesn't know what to do. But so that's more what we do on our side.
Earlier we were talking about frequency. You work with a lot of frequency-based therapies in Lyme and autoimmune labeled cases. What is the body actually responding to?
So when it comes to frequency, it's in my opinion one of the most powerful things you can do for the human body. So we have the Nerve Health Institute. We also have all our amazing clinic things, gadgets, methods, techniques here. But we wanted to help our patients more 24/7. So we developed a company called Body Charters, and we have all these types of things like frequency devices that are really just they're so, if you've ever heard of Rife or frequency, it's been around for many years. These devices are the most advanced frequency devices I've ever seen. You can put them in your pocket. There's settings for Lyme disease. These target cells in the body and retune cells in your body. So it's like it's restoring your cells and getting the frequency back to those cells to allow your body to do its job, which is to heal itself.
Yes. Are Lyme patients often hypersensitive to aggressive treatments?
Because their bodies are so debilitated and hijacked by all these different microbes that they function. And oftentimes their bodies are very toxic as well, because these microbes like living in a toxic environment. So the more debilitated they are, the less the body can bounce. It's kind of like asking a person who's never run before you can't start gradually, and that's the thing with these cases. So we know how to deal with it on a basis, because each individual is going to be different. Somebody might come in a little stronger than somebody else, and you have to know what to do and how to adapt.
What happens when a Lyme-affected nervous system finally receives signals it doesn't have to resist?
So when the brain gets awareness of cells that are disconnected, when we connect those cells, the self capacity gets restored. And then we also have a way of making the brain recognize these bad critters like Lyme and all the infections with it. And as soon as we make the brain recognize these things, it can actually start a process of talking to the immune system and saying, hey, you need to go do this. But it starts with restoring that power to the cells first.
We've seen a lot of public figures, including Justin Bieber, openly talk about the struggles related to Lyme disease. Why do even people with unlimited resources remain stuck?
Because they don't know about clinics like us. It's just, right? So that's part of the reason we're doing this, is because we want to educate people out there, just like you, about what we're doing and about possibilities. And literally all it is resources, right? I always say God gives you the resources, but you got to pick the right resources to get your body to do the best job of healing itself. So that's what we have here. Not only do we have this in our clinic, but we also, in the Nerve Health Institute, we also have body chargers for home. So a lot of our people will just go to body chargers and not even come to the clinic and get results. But obviously, if you want higher level, if you're sicker, you need to come here.
What does that reveal about how misunderstood Lyme really is?
There's a lot of conditions that are misunderstood. Just have a different understanding, I think, than most other clinics. And I'm not saying I'm, the most perfect, but I feel like where we are is common sense. How God made you, the basic ingredients that God put in your body, and restoring those basic ingredients. You can think about it: oxygen, water, light, frequency. Those are just massive ingredients. And when you restore those ingredients, health comes back.
Why does they often bring sympathy but never solutions?
So I think this particular condition, people don't want to admit they have it sometimes, because it's I don't say it's not an embarrassment to have the condition, but it's embarrassing if you were very successful, let's say, and then all of a sudden something like this gets you, and maybe you have all the money in the world and don't know what to do. So oftentimes, just with this condition, just become invisible, where they don't, when they have flare-ups and they don't be around anybody. So it's a joy when we see these patients like this get life. You can watch the life come back into their bodies.
What do these cases quietly expose about the limits of conventional Lyme and autoimmune frameworks?
So when it comes to conventional, most people just, if they have this condition, just stay on a massive amount of antibiotics. And in my opinion, it's not the proper way to manage, because, and for clarity, I can't tell people to take meds or not to take meds. That's not my jurisdiction. But into my overall opinion, when you eat massive amounts of antibiotics, it's going to kill bad stuff, but it's also going to kill good flora, good bacteria that are in your body. So it's a double whammy, right? So, and when it comes to conventional, there's a lot more to working with the body and getting it to heal itself that they're unaware of.
If someone has been told that they have Lyme disease and an autoimmune condition, what is the first assumption that needs to be questioned?
They should hear right away, because we're able to, or you just go to body chargers, but the assumption would be that person really sick, right? We talked about that a little bit earlier. You can both these conditions, that have a lot of cells that are very unhealthy in your body, that are toxic, that are hijacked and taken over by these microbes. And then your body starts reversing and getting scared, and the healthy cells in your body start attacking the bad cells. So not only are you under duress with all the microbes and the toxins, but your body is attacking, the bad cells. So it could be an awful scenario. And those are typically the ones we see. But we do have the ability to help those patients reverse.
What keeps you working with long-term Lyme cases that others usually would give up on?
It's the technology we have. When you do what we do, there's endless amounts of connections between your brain and your cell. So we can always, coming here, we can so many different things. Literally, you could come here every day for the rest of your life, and I probably couldn't check all the nerve connections to every single cell. Wow. It's that many. So when these types of cases are coming in, we can always find solutions. If something shifts and changes, we can always find a disconnect somewhere else that something can help with. And then the devices we have for home are wonderful because they can use them themselves, and they get into patterns when they understand, hey, I had this particular symptom and I used this particular setting and it went away. That's probably the most fun of my job, is when we teach our patients to do it at home and they help themselves.
That is very beautiful. What is the most damaging sentence a Lyme patient can hear early in their journey?
It's never going to go away. It's going to be there. You're going to always have side effects. You from it. I mean, we've have just some awful stories about things like this. So, or even worse, when they tell you that it's all in your head, and because they get the diagnosis of Lyme. Sometimes they doctor to doctor and just don't give them anything. They think it's in their head.
Well, that is it for today on Lyme. Thank you so much, Dr. Cormier, for all of your knowledge today.
Thanks so much.
If this conversation resonated with you, you don't have to figure it out alone. We have platforms built to be able to help you. Body Chargers is a platform we built that has all the tools, all the resources, all the methods that I recommend over these years of experience to help you at home. And it's so crucial that you do the right things. I can't impress upon you enough with your body. It has the full ability to heal itself. You just need to do the right things. That's exactly what we have at Body Chargers. And if you want higher level resources, we have the Nerve Health Institute, which is my clinic, and we'd be happy to help if you come here.